My name is Amy Munoz. I'm a social worker, and it's in the care coordination program. Care coordination, again, it encompasses so many things, but it really just coordinates care for a patient. And the population that I work with is medically complex kiddos and their families predominantly, doing just anything you can think of that surrounds their medical care. So case management at Cook Children's Medical Center is what consists of our case managers. It consists of social workers, and our case management department also consists of interpreters. We do overlap. So the nurse case manager will handle the medical side of it. In our program, that's what's so wonderful about care coordination is that we can do that. We can go out in the community, the social worker and the nurse case manager. We'll do that as a team. Caring for a medically fragile child can be extremely overwhelming. And it also depends on what kind of support a family has. They may have multiple children, and not only that, they may be struggling financially greatly. They may not have a vehicle to get to appointments, and they may have 10 appointments or more, maybe 20 in 1 month. That is extremely overwhelming. They have so many needs, so many pieces that are to do with their medical care, that in order to make sure that they get exactly what they need. And if that need's not met, or if those I's aren't dotted or T's aren't crossed, then they could end up back in the emergency room numerous times when those could have been avoided. Our families, they need to be taught many things, mostly by their physicians and their care team, their medical care team, but it needs to be reinforced outside of the clinic or reinforced once they're discharged from the hospital, and that's where we come in. I feel like too, I tell the families that when I start to work with them that my goal is to lessen your burden somewhat right now. You have so much to deal with. If I can lessen your burden by picking up the phone and calling a clinic for you to change an appointment or ask that question, I'll do that, especially depending on what's going on in their lives. Not all families need it, and I don't think that it is enabling them, because I think sometimes people will say, oh, well, they need to be doing it themselves. You're enabling them. I see it completely different. I think that if they could live their life for one day, they would go, oh my goodness, yes, I get it. You do need to help them more than maybe somebody else. The resources available to our department, our care coordination program in particular, the donor dollars, oh my goodness, it's just amazing. So many of my families have needs, and there are community resources out there, but they are so limited. It is so imperative and crucial that people give to Cook Children's, because I've seen firsthand how that has blessed families. I mean, enormously. Being able to tap into donor dollars to help a family get to an appointment by providing them a taxi voucher or providing them some gas assistance, it's been amazing.